committee meeting for August 17th, 2021. Could we please all salute the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, good evening, everybody. Could the superintendent please call the roll?
Ms. Chisholm.
Here.
Ms. Cormier.
Here.
Mr. Lipset. Here. Mr. Kissel. Here. Mr. Morenin. Present. Dr. Wells. Here. Ms. Crowley.
Present. So moving on to the agenda, approval of minutes of 6/8/21. Any action?
Motion approved.
Second. Any discussion on that motion? All in favor?
Aye.
That motion passes. Approval of minutes for 7/12/21. Any action?
Motion to approve.
Second.
Any discussion on that motion? All in favor?
Aye.
That motion passes, so minutes are now available for publication. All right, public comment. Couple of guidelines as we emerge into public comment for the Woburn School Committee. The Woburn School Committee has a very open public comment policy. We just request two things. One is your comments are limited to 3 minutes. Two is that we are respectful and kind to each other, and we do not disrupt when someone else is speaking. All of your public comments are going to be recorded and kept in public archives. We are being broadcast on public media. I should pause to ask, make sure we are being broadcast?
I believe so.
Okay. So this is how we're going to do it. We have a hybrid public comment. We will do the in-person people first, since they are in the school committee room, and then we'll move on to the folks that are waiting in Zoom. So let's begin.
And don't forget, we don't engage the people.
And of course, you can speak to us. Unfortunately, the school committee cannot have a back and forth with any constituent. It is only to testify in front of the school committee. We will listen very carefully and take in what you have to say regarding the agenda item of a mask policy. That being said, we will hear from the first person. Yes. Hi. Oh, I'm sorry. There's 2 chairs available right here.
Thank you.
And if you could just identify, give us your name.
My name is Heidi Richards.
Hello, Heidi.
Hi. So I'm here because I would like to express my concern on children wearing masks while in school. I'm the mother of a 5-year-old boy who is registered for kindergarten this fall. He is currently in an IEP program receiving speech therapy along with other needs. I personally disagree with masking children. Wearing masks eliminates nonverbal facial expressions and is detrimental to a typical child's development. Obstructing faces and muffling voices will be more severe impediment to social and emotional academic development. Children's risk of serious illness from COVID is extremely low, as well as transmission. I want my son to go to school, but without a mask. It should be my child, my choice. Years down the line, these kids are going to have respiratory issues. I just want my son to return to school in a normal environment, not the new normal, but the way it's supposed to be. That's all I have to say.
Thank you. Thank you very much for those respectful comments. Okay, public comment is still open for the next constituent that would like to address the school committee.
Hi, I'm Evelyn Riley. I live on Carter Street in Woburn.
Hello, Ms. Riley.
Hello. I'm a parent of an incoming freshman at the high school. I'm speaking against the mask mandate in the Woburn Public Schools, and instead am proposing the mask remain the personal choice of the respective parents. I'm an insurance adjuster by trade, so it's my job to assess risk. Since the pandemic began, it has been a constant balancing act between the risk of COVID and the reward of work, school, and everyday life. There have been approximately 600,000 deaths in the United States from COVID. Of that figure, 349 people were between the ages of 0 and 17 years old. That is 0.057%. The overall COVID fatality rate is 1.65%. In other words, there is a 98.35% chance of survival. The average age of a COVID death in Massachusetts is 73 years old. The average death on breakthrough cases where the person has already been vaccinated is 82 years old. To my knowledge, there have been 0 deaths in children between the ages of 0 to 18 years old in Massachusetts from COVID. Statistically, for the history of this pandemic, children under 18 have been the lowest risk category. We have fallen into a dangerous pattern with COVID where we place blame on each other over the spread when in fact infectious disease is a risk we have accepted as a community and a nation our entire lives. With COVID, we have put such fear into our children that they can't concentrate, they have increased mental health issues, and they feel a sense of guilt if they somehow feel they made someone else sick. That is unsustainable and unhealthy. Again, the survival rate is 98.35%. Our last line of defense remains and will always be our own immune system. The impacts of chronic fear include damage to a person's physical health, memory, brain processing, and mental health. We need to accept COVID's presence in our lives and work on our natural defenses to it. High schoolers have had the option to get the vaccines, which is a personal choice. At this time, it should be up to the parents and their respective children on if they wear a mask in school. If it is safe to unmask at lunch and in gym class, why is it not safe to unmask in the classroom? By the Mass Department of Education and the CDC's own guidelines, if someone is higher risk, they do recommend that higher risk person wear a mask, because wearing a mask can provide you, as the higher risk person, some additional protection without mandating that same requirement to others. Governor Baker has noted the high vaccination rate in Massachusetts and relatively low COVID rates in the state as substantiation for not issuing a statewide mask mandate. Let us follow his lead and let the parents decide the best choice for their children. Thank you.
Thank you, Ms. Riley. Public comment is still open. Would anyone else in the audience like to address the school committee? Yes, come on down, please. Please just state your name and perhaps what school you're affiliated with. You don't have to give your
I'm
address.
Lisa Murphy. I have 3 kids in the Woburn Public Schools,
Hello,
2
Ms.
at
Murphy.
the Harold Wyman and 1 at the Kennedy.
Thank you, Ms. Murphy.
Thanks.
Please go ahead.
So I'm here on behalf of my children and other parents here to advocate that we hold the line and stay in line with what is recommended by the governor in DC and keep masks strongly recommended and not mandated, allowing parents to decide what's best for their child. I'll start by saying children are mercifully spared from the adverse effects of this virus. They are, however, at risk of suffering indirect impacts of policy decisions that are made without fully considering consequences. If masks are to be mandated universally, the burden of proof is on you to prove consistent efficacy in preventing transmission and providing better outcomes against the virus. Efficacy that outweighs the negative impacts of masks on learning and social emotional growth. I would argue that that has not been done, and therefore the choice should be left up to the parents. Who is this mandate set to protect? The risk to children themselves is minimal, even with the more transmissible Delta variant. Last week, Boston Children's Hospital confirmed there is no increase in cases or hospitalizations for children in Massachusetts. There are currently only 2 children hospitalized in the state that have tested COVID positive. There are 0 deaths out of 1.8 million kids due to COVID in the state. That number is for the last 18 months, 2 COVID seasons. Nationwide, there's less than 350 child deaths due to COVID in that time frame. To put that in perspective, there were 480 children that died during the 2018-2019 flu season, an 8-month season that was considered mild for the flu. If it's not to protect the children, and children are not in need of protection, who is this for? If it's for the staff, every employee has had an opportunity to receive a vaccine, so that risk has been mitigated by that vaccine or personally accepted. If it's for the community as a whole, 18 months of real-world data has found that using a mask mandate within a school versus leaving it strongly recommended has had no effect on transmission within the school or community as a whole. As a matter of fact, in some circumstances, it showed increased spread. Throughout the pandemic, we've been in a constant state of fear and uncertainty. Fight or flight is activated. It's difficult to retain rational thought. Thoughts have become very black and white. You may be thinking it's just not safe in school until kids can get a vaccine. But the fact is, an unvaccinated 6-year-old is at less risk statistically than a 30-year-old that has had the vaccine. Remaining fixated on a single threat has stopped us from recognizing broader human needs. This is the 3rd year of interrupted school for these kids. First graders coming in this year have never seen their teacher's face or a classmate's smile during a typical school day. I have respect and sympathize with the anxious parents who want to lean on masks because they give an outward appearance of being in control or an illusion of doing something, but there's simply no concrete evidence that they do anything. The harms are plain to see. Masks are a barrier of empathy, communication, quality social engagement. There are negative impacts to literacy, speech, social development, especially in the youngest children. They're physically uncomfortable. They are vectors of pathogens as they sit damp on a child's face for 6 hours. Kids need to see faces. They need to see that teacher's mouth move as they learn to read. They need to hear voices that aren't muffled by masks. They do not need to feel constantly isolated and reminded that they are a danger to everyone around them. I have friends who are on wait lists, waiting months to receive mental health services for their children. Mass ER visits for pediatric suicide attempts in the age range of 8 to 18 are up 80%, not because of the virus, because of the policies. There is simply no evidence that masks work enough to outweigh the social emotional costs to children. Finally, if we mandate masks today, what is the off-ramp? When does this stop? You may say, when they're able to receive the vaccine. We don't know when that will happen or even if it will happen at all. Even without the vaccine, the flu still poses greater risk to children than COVID. So if we continue with this line of thinking, wouldn't we then mask indefinitely for flu as well? If we don't stop now, this never stops. Universal masking in school, while highly visual and socially evasive, simply does not do enough to protect anyone. Making masking optional does not stop anyone that wants to from masking their child. There is nothing hazardous, risky, or dangerous about a mask optional policy. Leave this choice in the parents' hands.
Thank you, Ms. I just want to appreciate everyone's respectful and well thought out comments, but I would just ask you to stick to the 3-minute limit. So I don't want to have to gavel anybody. Okay, public comment is still open. Would anyone else in the audience like to address the school committee?
Ellen, is it okay if a child spoke? Why not?
Absolutely. Hi.
Hi,
My name's Ellen. What's your name?
Julia.
Hi, Julia. Are you with your mom? Awesome. Go ahead.
Now, I do not want to wear a mask in my school, especially ever since I got glasses, because every time I wear a mask, it's uncomfortable and my glasses fog up. Now, no kid likes to wear a mask, and I should know since I am one. So, and everyone wants to see a kid smile, but with masks, that covers it. And all the stuff about mask break, it's not exactly true, because the only mask breaks we get is at lunch. So unless by mask breaks you meant by lunch, then mask breaks is just a joke. So I think we should have a choice to be vaccinated or not. Because us kids need to communicate with our friends and not be muffled over a mask. So let's show those smiles, shall we?
Thank you, Julia. That was very brave of you. Okay, public comment is still open. Yes, come on. Hi.
Hi. I wasn't even planning on coming tonight.
Okay. No, that's fine.
My name is Patty Copley.
Yep.
I have 5 grandchildren under the age of 10. 2 of them go to the Shamrock School. What I'm going to tell you right now is my husband, 75, was diagnosed with stage 4 cancer. He's been through 3 operations. He's paralyzed. He doesn't walk. He's been in and out of nursing homes. And you know what he said to me when I go up to visit him? The worst thing about all the experiences he's had since October 9th is that people have masks and that he says, I can't see their expressions. I don't understand what they're saying. All that he's been through, and he's a 75-year-old man, has been horrendous. So can you imagine these kids? So are you people really listening to how we feel? Is that how the vote's going to go? Are you really listening to what everybody's saying?
We can't
Is that
respond to you,
is
just
that
so
what
you
this
know.
meeting's about?
Well, we can't respond to you.
Oh, okay. Oh, you can't respond. All right,
So
that's
I'm
fine.
sorry.
That- oh,
We're not
that's
just
fine.
like
I'm just
paralyzed,
curious.
catatonic. We
Yeah,
just can't, we literally
sorry.
can't respond. That's okay.
But I just want to say, if a 75-year-old man who's been through what he's been through this last year, and he tells me the worst thing that he's been through is that he can't see the nurses, he can't tell if they're mad at him, he can't tell if they're smiling, he can't understand them. So just, let's take that from a man who's 75 and think about the children. Let the kids be kids. I mean, I'm not getting up here saying all the statistics. The speakers before me did a great job. So that's all I have to say.
Thank you, and I'm not sure I caught your name there. Can you just...
Patty Coakley.
Patty Coakley, okay, I'm sorry, you said her name. Okay, yes. Hi.
Hi.
Welcome.
My name's Jasmine Parthasarathi. I have 2 unvaccinated children who will be attending Goodyear Elementary
Hello.
School.
Hi, good evening.
I hear from a lot of mask opponents that masks are annoying and that kids don't like wearing them. And I get that. Masks are a pain. But the worst thing that we can say about masks is that they're annoying, whereas COVID is a global pandemic that has killed almost 4.5 million people worldwide, and it's nowhere close to over. When you are weighing the risks of masks versus no masks, it's not even close. I get that some kids don't want to wear masks, and who could blame them? But there's a reason we don't let our kids call the shots. Mine would eat cake for every meal, set things on fire just to see what happens, and they'd never wear their seatbelts. Kids are just not capable of making these sort of cost-benefit analyses. It's our job to know what's best for them and to enforce it, even when it's not popular. Children can't learn when they don't feel safe, and our kids deserve to feel safe. They deserve to learn, and that won't happen if the schools shut down again due to increased transmissions, not without a virtual learning model in place, such as the one we had last year. It is simply not enough to say, if you're worried about it, put a mask on your kid. My 2 kids will be wearing masks at school this year, but science tells us that universal masking is far more effective at stopping the spread of COVID than selective masking. Our kids deserve an education that is uninterrupted by school shutdowns, and they deserve to be kept safe in their schools. I respectfully ask that you please vote to require masks. Thank you.
Thank you. Thank you very much. Public comment is still open? Yes, hi, Ms. Goldstein.
Hello, my name is Dale Goldstein. I have an 8-year-old in the Hurl-Lyman district. I'm here tonight to ask that you implement a real policy that mandates masks that are well-fitting over the nose and the mouth for all students, staff, and visitors. I ask that you stop using the term strongly encourage for something that is needed to keep our children safe. You don't strongly encourage dress codes, codes of conduct, or principles of academic integrity. You require them. Masking should be treated the same way. By now, you already know that masking is recommended by all of the professional organizations tasked with caring for our children and communities. I don't need to repeat all of this to you. As elected officials, you have a responsibility to follow these evidence-based recommendations, regardless of your opinion. You have a responsibility to follow the expert recommendations to keep our children safe and to keep them in school. If your priority is full-time in-person education, evidence-based mitigation strategies must be followed. This includes vaccination and masking. These evidence-based recommendations come from real science, analyzed by professionals with appropriate qualifications who have the skills to differentiate between pseudoscience and real data. When there is increased community spread, there is an increased chance that our children's education will be interrupted. You must add as many layers of protection as possible in order to ensure our children can stay in school. Are masks easy for kids? Absolutely not. Is masking easy for teachers? Definitely not. Could masks make it harder for some children to focus on learning? Yes. And my heart goes out to those children. But do you know what's even harder on kids? Watching a parent or a loved one fight through a serious illness. Watching a parent or a loved one fight to recover in a hospital room. Watching a parent or a loved one fight for months on end to recover at home from serious illness. My 8-year-old daughter has been watching this happen every day for the past several years. As much as she dislikes wearing her mask, I can guarantee you that she would rather do that than to continue to watch her daddy fight for his health every day. As educators, parents, trusted adults, and leaders, it is our responsibility to teach our children to do what is right, not what is easy. We teach our children about being part of a community and working together in order to function as a society. What better way to teach this than to lead by example? To teach them that sometimes we need to do hard things, uncomfortable things, in order to protect each other and our most vulnerable community members. Thank you.
Thank you, Ms. Goldstein. Okay, public comment for the school committee is still open. Would anyone else like to address the school committee?
Hi. I didn't prepare anything, so I'm just going to go
That's
off
all right.
the fly.
Go with it, girl.
Hi, my name is Marie Delgado. I have 2 children in the school system. One will be in the 6th grade at the Joyce, and the other will be starting high school. I just kindly ask that you guys take into consideration to leave the option to us as the parents to decide. There are children, there are science. They're not your science or the science outside. There are children, and we have the right to choose what is best for them. I mean, I don't know how many of you guys have children in the school system. Probably not a lot of you guys that are currently going to school. I know you do because our kids go to school together, but take into consideration these kids are going to be taking their mask off in class. They've already lost 2 years of education, whatever, the past 2 years. They had half of my daughter had half of 4th grade and basically a little bit of 5th grade. The teachers are going to be spending so much time in the classrooms. Instead of teaching, they're going to be like, put your mask on. You can't have your mask on. Take it off. Like, that's going to be so much time wasted in the classrooms every day. And if you think these kids aren't going to be swapping masks, they're going to be swapping masks every day. They're going to be dropping them on the floor. It's even worse. And, COVID's not going anywhere. It's going to stay. People get cancer. They see people die. People get COVID. I'm sorry, it's part of life. Everyone's going to die eventually. We don't know. We could walk out here right now and die. We don't know. But I kindly ask that you guys leave it up to us as the mothers and the fathers to choose what's right for our children. That's it. I don't think I have anything else to say.
Thank you, Ms. Delgado. Anyone else? Public comment is still open. Mr. Chinova. Hi, good evening.
Hello, my name is Derek Chinova. I have an 8-year-old and a 6-year-old entering at the Malcolm White. I am a resident of Woburn and a high school teacher in another district. Last year, I taught hybrid classes where half my students were at home and half were in the classroom. It was a miserable experience that I never want to repeat in my life. When we returned in April, I wore a mask and all my students wore masks. It wasn't ideal, but it felt relatively normal. We wore masks all the way to the end of the year, weeks after most people had stopped wearing them in stores and restaurants. It was a bit annoying, but after hybrid teaching for 7 months, I didn't care. Like most of you, I'd assumed and hoped that this year would be completely normal, but as we're seeing, we're not entirely through this thing yet. I don't enjoy wearing a mask. It's harder to read students' expressions and to convey everything I want, but I will happily wear one if it keeps us from ever having to go remote again. Think back to last year at this time. We would have been thrilled to simply wear masks if it had meant we could be in schools full time. That is the #1 goal here, and that is why we should require masks, even if you believe it's not necessary. Other schools in the country with lower vaccination rates and no such requirements have already faced major issues within the first week of school. Mississippi has had several schools closed with outbreaks, and over 5,000 Tampa students and 300 staff have already had to isolate. We're probably in a better position than many of them, but it's not certain. Our K-6 students mostly can't get the vaccination yet. As I said, I have a 6 and an 8-year-old. If one of them gets the virus, they will likely recover without any serious complications. But even in that best case scenario, my wife or I will have to take off weeks of work to care for them while they isolate and quarantine. You'll likely have to do the same. That would be a serious disruption on an individual level, but if it happens to enough students, it will dramatically affect the entire classroom. Can we guarantee that masks would prevent such a situation from happening? No, but it will make it far less likely. We all need to wear masks. It's literally the least we can do. Thank you.
Thank you, Mr. Chinova. Yes, hello.
Good evening. Thank you for the opportunity to speak to the school committee. My name is Dr. Wayne Altman. I'm a family physician in Arlington and chair of the Department of Family Medicine at Tufts Medical School. More importantly, I'm a parent of children in the Woburn Public Schools, one who's rising 9th grader and one who's a rising 10th grader. I'm joined by Maggie Resselai, who's a third-year medical student at Tufts Medical School. So I want to start by saying I'm here to give a proposal to you all to consider that would unmask all the children in the high school. And I want to follow that by saying that this is a public health issue. This is not a we have freedom so we can do what we want issue. Public health works differently than freedom and we can do what we want to. For example, if someone says this is a free country, I have the freedom to have 6 drinks and then drive in my car, you don't have that freedom because driving under the influence is a public health issue. It affects other people. It doesn't just affect yourself. I would also hope that the applause in the background for such freedom and for such passion for the kids to take their masks off, I would hope that there's a 100% vaccination rate for, amongst all of you. Because,
please, thank you.
Because if you are passionate about the kids taking their masks off, that is how we get there. And that's what my proposal is about. I had a meeting today with several infectious disease leaders in the state of Massachusetts, as well as the president of the Massachusetts Academy of Pediatricians. And we are all in favor of this proposal. This proposal is also being presented in the Westboro School Committee tonight as we speak. The statistics in Woburn, I have them here, from 16 to 19-year-olds, it looks like 76% have had at least one vaccine and 67% fully vaccinated, and I would expect that that 67 will come soon to 76 and even beyond quite soon. I think these statistics may be about a week old, but they're pretty accurate. In Westboro, 97% of the high school is vaccinated, which is interesting. And so here's what I'm proposing, that all the kids, this is high school only, the reason being K through 5, none of those kids have an opportunity to be vaccinated yet. We expect in January that will change roughly. In 6th through 8, the 6th graders probably won't have an opportunity to be vaccinated, and they're all mixed together with 6, 7, and 8. So this is most appropriate for the high school where every child has an opportunity to be vaccinated. What we're proposing is an 80% vaccination rate as a threshold to have permission to take the masks off for the entire school, the teachers, the kids, everybody. I've spoken to a number of teachers who have reported the same thing that the gentleman who preceded me was talking about, that communication and body language is really thwarted by the masks. I think we can all agree that education is better with masks off than masks on. I think we can all agree that if COVID cases rise with the variants and we have to go back to remote learning, it would be devastating for all of us. And so we want to get the masks off in a safe way, but we also don't want to go backwards. And that's where we're trying to thread that needle here. And how can we do that? And we think this is the way to do that. And so it's a 3-part criteria, and we're still working out the details. The first detail is an 80% vaccination rate of the teachers and the students together as one community in the high school. They're in this together. I read that the Massachusetts Teachers Association recently endorsed mandatory vaccination for teachers, and that may help that number rise above 80%. The second criteria would be a community and school infection rate. If there was a rapid rise or an increase above a certain amount, that would be the trap door where you'd have to stop the unmasking even if you were above that 80% vaccination rate. And the third would be a possible requirement of pool testing in the schools to follow that rate, where we would study the data and report. And this would be two major motivations to do this. Motivation number one is better education for the kids so that they can take their masks off. Motivation number two is to motivate more people to get vaccinated, parents and children, so that we can get to that point where we can safely take our masks off. Time.
10 more seconds, maybe.
No, I'm good.
Okay.
Thank you. Thank you for the opportunity.
The school committee can't respond to a specific proposal because it's public
course.
comment, but the school committee can certainly deliberate it when we talk about the policy. Well, the meeting's being live streamed.
I mean, they're saying they can't hear anything.
Oh, okay.
It's streamed, but
They can't hear anything from
that's what I'm getting.
the live stream?
I believe that in order to view the meeting, they should be on YouTube, on the Woburn Public Media Center page. The Zoom is for public comment.
Okay.
I'll just say one last thing.
Thank you, Mr. Chinova.
I'm available offline if I can be of any help to the committee.
Thank you, Dr. Altman.
Thank you.
Okay. Public comment for the Woburn School Committee is still open. Would anyone else like to address the committee? Hello.
Hi.
Hi.
I didn't plan on coming, but I thought it was very important. I know you guys have a hard decision to make, and obviously there's a lot of opinions on both sides. I just want to let you know my thoughts.
Would you mind sharing your name?
Heather Wilson. I have 2 children going into the high school.
Thank you.
I spent last May in the hospital with my son because he wanted to commit suicide because he had to wear a mask. So there's mental health issues here too that I think you need to think about, not just our physical health. COVID, now we have treatment. So people aren't dying. We have ivermectin, hydrochloroquine. There's things, again, someone mentioned, 99.1% of children this disease is not going to harm them. So we really need to look at the risks and the benefits, so I just want you to think about both. Also, it is against the law to mandate someone to take a vaccine that is an experimental drug, the Nuremberg Code. I'm dealing this with my work as well. I'm a dietitian. I promote health, and I promote my children to eat healthy, take care of themselves, take the vitamins and minerals. We want to support our immune system instead of making it worse by wearing a mask and getting and not exercising and not participating in sports. Both my kids will not participate in sports if they have to wear a mask. It's just been detrimental to both their physical and their mental health. Thank you.
Thank you. Sorry about Public comment is still open. Would anyone like to address the school committee? Hello, Ms. Kuberry.
Hey, I'm Rachel Kuberry, and I have an incoming first grader at the Harold Wyman. I'm going to be short. I'm just here to support required masking for children and staff in the fall. I'm particularly concerned about our elementary students who are too young to be vaccinated and other people who can't be vaccinated. I don't need to go over the data and the science and everything, but I just want to point out that, you know, last year my daughter was home. She was in the virtual academy. I really appreciate that we had that opportunity to do that for her last year, and we had that choice. I really felt like last year, both as a teacher and as a parent, was a big experiment, both, you know, here in Woburn, in the state, and in the country, and really everywhere. And I think we didn't know what was going to happen, and we had the capacity to keep my daughter home, and that's what we did. It was a good experiment, and we know the results now, and the experiment really found very, very little, if any, in-school transmission, and that was probably a lot due to the mitigation strategies, masking, distancing, ventilation, and so on. We're changing some of those variables this year as we end virtual academy and we put more kids back in the classrooms. I'm just asking that we don't change all the variables, we control ones that we can, and that we keep masking in place and see how that goes, because a lot of science supports that. So, thanks, guys.
Thank you. Okay, is there anybody else that would like to address the school committee? Yes, come on down, sir.
Good evening, everyone.
Hello, sir.
Hi. My name is Dave Gannon. I got 3 children currently enrolled in the Woburn schools, 2 in the Linscott and 1 in the Kennedy. So a couple of things here. The American Academy of Pediatrics listed that 23 states reported less than 2% of all children COVID-19 cases resulted in hospitalization. 43 states reported children were 0 to 0.26% of all COVID deaths, and 7 states reported 0 children death. Children are less at risk of contracting COVID and dying from it than vaccinated adults. Since the UN, ICEF, and WHO issued guidelines in August, the evidence is emerging from schools that show that masks and other restrictions are unnecessary for children of all age. The Swedish economist at the University of Stockholm conducted the most rigorous comprehensive study. During last spring's outbreak, Sweden, in effect, undertook a nationwide controlled experiment by switching its seniors in high school to online and keeping the younger students in the classroom with few COVID restrictions. Class sizes for the younger students were not reduced, and students who had been in contact with an infected person were still allowed to go to school. Neither teachers nor students were encouraged to wear masks. In fact, the authorities discouraged the wearing of masks, and very few were Swedish wore any of them last year. None of the children who kept going to school died of COVID, and there was little to affect on the adults in their lives either. The Swedish researchers analyzed the rate of COVID infections and medical treatment among hundreds and thousands of teachers and parents. The economists compared 2 groups of parents with similar aged children, those with 9th graders who kept going to school and 10th graders who stayed home. There was no difference in the risk of serious COVID disease. The parents whose children kept going to school were slightly more likely to test positive for COVID, but no more likely to be treated or hospitalized for it than the parents who stayed home. The unmasked teachers in the classrooms at the junior highs were likely to be hospitalized for COVID, more likely to be hospitalized for COVID than their online teachers, but the difference was hardly catastrophic, 0.09%, meaning there was less than 1 additional severe case for every 1,000 classroom teachers. Researchers from the University of Witten-Hemlock in Germany have cataloged other problems. They established an online registry for parents to report the side effects of wearing a mask. Among the nearly 18,000 parents who chose to respond, more than half of them reported that masks were giving their child headaches and making it difficult to concentrate. More than 1/3 other effects were increased reluctancy to go to school, unhappiness, malice, impaired learning, drowsiness, and fatigue. After considering these reports and well testimony from other researchers, a court in Weimar, Germany, recently ruled in favor of the parents to make the choice for the basic rights of their children. The court ordered the schools to end the mandates, declaring that they damage mental, physical, and well-being spirituality of the children. All of this was noticeably beneficial for themselves and the third parties.
Thank you, sir. Anyone else would like to address the school committee? Anyone else would like to address the school committee?
Anybody on Zoom?
We have one. No, I have the Zoom. Okay, yep, come on down. No problem.
I didn't prepare anything, so I'll try to keep it short and not ramble here.
Okay, hello, Ms. Cotton.
All right, Julie Cotton, 17 Darling Drive. So I'm in favor of a mask mandate. I have 3 children with special needs. 2 are at Shamrock, and 1 next year will be entering kindergarten. He's still in preschool. And to be honest, my kids have been fine with wearing a mask. That hasn't been an issue for us. The thing that was a real challenge for us was the lost time physically in school. Remote learning did not work for our family. And particularly for my child who has significant special needs. She has autism, and she needs to be in front of a person. The mask, notwithstanding, obviously it's ideal for her to see someone's face. They got the ones with the window, they got the little screen thing, and they got all that stuff. But for her, being behind a computer, trying to talk to a person, it was me sitting there facilitating these half-hearted interactions. She just couldn't do it. My other daughter was devastated not being in school. That was a real toll on her mental health. It wasn't the mask, it was the disruption to her education by not being able to be in school. And for her, she would have worn pretty much anything. She would have worn a chicken suit to school every day if she could get back in the classroom with her friends. I will do anything I can with my own family, and I hope that our community will as well, to keep our kids physically in school buildings in the safest way possible, so we don't have any more disruptions like that. That's my number one goal. I think that that will significantly support our kids' education, so we can just get through this and try to come out the other side of it. That's all for me. Thank you.
Yes, come on down.
Hi, my name is Caitlin Explosion. I have a 5-year-old child going into kindergarten in September. I wasn't expecting to say anything, so I'm a little flustered, but I can't imagine sending her to school knowing that there's like a tiny thing we could do that would make her a little bit safer. Just a little bit safer. A little bit. Doesn't have to be like, it's like putting her on a bike without a helmet. Why wouldn't you? Why wouldn't you put her in a mask? The kids don't mind wearing masks unless you teach them not to mind wearing a mask. She doesn't mind wearing a mask. I don't know any other 5-year-olds that have a serious issue with it. It seems like the science is pretty clear that masks kept a lot of kids safe last year. Like there's all kinds of, I didn't bring anything, so I can't give you the numbers, but I'm sure you've seen them. I hope you've seen them if you're the school committee for this town. If our kids go to school, which I think is the most important thing here, that our kids go to school. If they go to school without masks, there will be community transmission increases. And if that happens, then the schools will end up being the first things shut down again. The schools will be shut down, and then we'll have to do remote school again, which I know was miserable for everyone. It was miserable for teachers. I don't suppose there's any kind of plan for that right now, going back to remote schooling at this point. I haven't heard anything about a plan for remote school this year, so I don't suppose there is one. And if there isn't a plan, we're going to have that same mess that we had in the beginning of the pandemic in 2020. Nobody knew what was going on. Everyone was just home. No one could go to work. Kids couldn't go to school. People lost their jobs. They lost a lot of money. A lot of people were in a really bad way. I don't think that I can go to remote kindergarten. And I would have to go to that. I really don't want to. It seems a lot easier to let the kids wear masks until community transmission rates get to a certain level, at which point we would feel safer letting our kids not wear masks at school as long as the adults are vaccinated. Everyone who's making recommendations, the teachers, the biggest teachers union is supporting teachers being vaccinated. The World Health Organization recommends kids wearing masks. Anyone who's unvaccinated wearing masks indoors is what they're saying right now. Kids are unvaccinated. Doesn't seem like that big a deal. I know that there are very strong feelings about it being actually a very big deal, and I can totally understand that. It just seems like such a simple, small thing that we could do to make kids a little safer. Because if 99% of the kids don't die, if that 1% is my kid, that's way too many.
Thank you, Ms. Explosion. Okay, is there anyone else in the in-person portion of public comment wish to speak? Or I'll move to Zoom. I see Councilor Concanon is here. I want to acknowledge him in the audience. And also Barbara Locke is also here as well. So thank you guys for coming. I'm going to move to Zoom. Okay, guys. All right. Put your name in the chat right now if you would like to be recognized to speak. If anyone would like to address the school committee, Jackie Bottaro, you can unmute. Go ahead. Say it again.
Hello, can you hear me?
Yes.
All right. My name is Jacob Stanley. I have a daughter at the Malcolm White who is going into 3rd grade. I didn't come with any sort of statistics or anything to spout off about, other than, luckily for me, I was able to have the capacity to have my daughter do full virtual school, which was definitely a burden and a hassle to deal with and figure out how to do. But we got through it, and my daughter, her reading level doubled. Her ability to comprehend a lot of things was, difficult at times, and I had to with her math a lot of the ways, which was very difficult, which I'm not trained to do. I am a chef. I am not a teacher, and there are qualified teachers who would love to be in school with our children. But I find it completely unfair to these people, these wonderful people who have spent their lives training to, ready our children for the world, and expecting them to risk themselves and the children and everyone around them, their loved ones, their older elderly family member and other young children who I've had to go through that. People close to me have had this virus, and it has caused deaths in my family, and that's devastating. And to have people sit and spout statistics about, a 1% or a 2% or a 4% survival rate feels pretty cold when there are people who are the 4% or the 1% or the 2% who are dying and going through lifelong health crises, and all because they refuse to do some small thing. Fine, don't get a vaccine. That's up to you. Up to you totally. That's fine. Your decision is your own, but the consequences of those decisions are not just yours. They are for everyone. And as the father of a daughter who has happily worn a mask, there have been no issues. Yes, there have been times where she doesn't understand certain things, where you'll have to convey certain emotions in different ways. But a lot of the reasons that she wears a mask is because she has a sister who is immunocompromised. And if she comes home with something, it could end her life. A young child's life snuffed out over a small decision that all of us can make. Doctors, nurses, medical professionals, and all of these people have been wearing masks for decades, and not a single person has questioned them in operating rooms or doctor's office. But the second you want your child to wear one, it's a big problem. I support a mask mandate in our schools, and I will always have my child in one when they are around, because I care about your child as much as I care about my child's life. Thank you for allowing me to speak before you guys. I appreciate the time.
Thank you, Mr. Stanley. You can't. I don't know if you can see the school committee. I don't know what you're doing, but we all heard you, and everyone was nodding. Just so you know.
Thank you very much. Yes, I have it on YouTube. I'll probably watch it back.
Okay.
Can I just add?
Yes, Ms. Spataro. Yes.
Sorry, I just want to add something really quick. Something that this child has expressed to us is being nervous about going back, and if the mandate isn't active, she's nervous that other students will tease her for wearing a mask. And that's just so deeply concerning to me, and not only am I in support of the mask mandate, but I'm also pleading with other parents who maybe have a difference in opinion on this. No matter where it goes, please teach your children to be compassionate and not question other students on why they're wearing a mask and why they made that choice. Please teach them to be compassionate and kind. Thank you.
Thank you, Ms. Spataro and Mr. Stanley. Jennifer Jones.
Hey, thank you. My name is Jennifer Jones. I'm at 4 Sherman Terrace in Woburn. And I sent a letter to the school committee, so I'm sure that you read all of that, but I just wanted to speak again today. As we're hearing more and more communities are taking the action to impose a mask mandate, and it's really for the consistency in the school. And we spent a lot of time last year talking about the social and emotional health of our students, and that they were out of school and they were away from their friends. And this, I think someone earlier said, this is the least we can do. When we're bringing all of the students back to full capacity, we're not going to be able to have the distance. We're probably not going to have the amount of time to be disinfecting all the things and doing all of that. But to make sure that we have masks on to do just the least amount that we can to protect our students. I know my kids, I was at a farmer's market today. It was 85 degrees out, and there were kids in masks running around, and they're playing, and they were meeting friends, or they didn't even know the other kids. They were just running and playing together. And I was like, those kids don't have a problem with masks, and it's because their parents don't have a problem with masks. If we're modeling positive mask behavior and as I've told my kids, we're doing this for ourselves and for other people, and it's just to be healthy, and it's just to be safe, and it's not forever. It's until maybe December when we can get those younger students vaccinated, when we get more of the middle schoolers vaccinated because they age up to 12. We're getting close, but let's do this together as a community. And I appreciate your attention to what the experts are saying, much more than I could say. I'm not an expert, I'm just a parent that wants the best for their student. So thank you very much for the opportunity to speak tonight.
Thank you, Ms. Jones. Ms. Hess? Jen Hess?
Yes, hang on. Just doing my video. Hi, yeah. I didn't prepare anything either, but and I tuned in a little bit late, so I apologize if I'm repeating anything. But in all the debates about masks, I haven't seen a whole lot of people address the fact that we honestly don't know really what the long-term prognoses might be. Even if none of the kids die, like great, I'm sure we can all agree that the correct number of dead kids in Woburn is 0, along with the correct number of dead teachers or staff. But we don't really know what happens 5 years from now when somebody recovers from COVID. Are we going to find out that it's like chickenpox, where you get chickenpox and you recover and that's great, and then 30 years later you get a debilitating case of shingles? So I think we just don't know, and it seems like, as Jennifer Jones said and others have said, it's a small thing to do to wear some cloth on your face so that potentially nobody has, terrible heart disease 20 or 30 or 40 years from now. So I'd really like to think about the fact that we just don't know what we don't know. Why not play it safe and just put some cloth on your face? Nobody likes wearing a mask. I don't like it. But so what? Big deal. Like, I do a lot of things that I don't particularly like doing because I'm a grown-up and, I teach my kids the same thing. Sometimes you don't get what you want. You just do the right thing. So that I kind of feel like I'm a little disappointed we're even having a debate about it, because if we guess wrong, we don't even know what we might be facing down the road. And instead, I'd really rather we just err on the side of caution. So thank you all. Thanks everyone for addressing this and being thoughtful.
Thank you, Ms. Hess. I just want to remind my Zoom public commenters that we are sticking to a 3-minute time limit. No one has hit it yet, but I am keeping track. Okay. Yacinda Haro. Okay, Matt.
Can you hear me?
Yes. Sorry.
Okay, perfect. Thank you. Thank you, everyone. Jacinda Felix Haro. I have a rising 7th grader and a rising 4th grader entering school this fall. We did online learning this whole year. I'm happy to say that my children did well, but I also know that a lot of children did not do well. And what I don't want to go back to is virtual school. I agree with everyone so far who has said how important it is to have children in person. And the way to do that is for everyone to get vaccinated who can and who's eligible, and to wear masks until we hit 80% vaccination rate, because that is herd immunity. People have a right to say they don't want a vaccine, that's fine, but then we have to wear masks and we have to do other mitigating factors. The Journal of the American Medical Association yesterday came out with a study. Kids that are transmitting COVID, the cases have been increasing. And what's scary about this is, yes, we don't want any child to die, so I don't know why we're arguing over percentages, but we don't know long-term effects. Children are passing this disease to others, and that is scary. I don't know about you, but you probably have immunocompromised people in your family, older people in your family. You may even have people that can't get a vaccine due to medical conditions, and children are transmitting this disease. So that is something to keep in mind. Not to even mention the fact that don't we care about our teachers and staff in the buildings, and we should be protecting them as well. We are really getting close to having no ICU beds for children. So the gentleman that spoke earlier was speaking about in 23 states, less than 2% of children have COVID, but last Saturday, 1,900 over 1,900 kids were hospitalized for COVID. So when you think about that, that is a scary thought. That's a lot of children. And our ICU beds we're running out of them. And we may not be running out of them in Massachusetts right now, but if we continue on this path, that's what's going to happen. I kindly ask that people consider, it is the least we can do. I kindly ask people to consider the CDC guidelines. The CDC guidelines say that anyone who's unvaccinated needs to wear a mask. Let me repeat, anyone who is unvaccinated needs to wear a mask. My children are not old enough to get a vaccine. They have to wear a mask according to the CDC. I would also be careful, and I would ask that when people are out here citing statistics and numbers, that they actually know where those numbers are coming from and that they share that with the group, as I just did about the Journal of American Medical Association. If you're reading your numbers from a valid place, it would help to share that with the group so we know where you're getting your numbers from.
10 seconds. 10 seconds left. Go ahead.
And that's all I really want to say, and I thank you for the time, and I hope you all have a lovely night.
Thank you. Appreciate the respectful comments as well as the respectful comments in person. Moving on to Madeline.
Hello. Thank you for the time tonight and for the respectful conversation. I'm a parent of a going into first grade who attended Virtual Academy in the last school year for kindergarten. And like many of the parents here, I won't repeat the experiences we had there. I do want to just respond to or add on to a point that was Hess made earlier about the fact that we just don't truly understand the long-term effects of this illness on children or adults, for that matter. My wife has a chronic illness, and that is the primary reason we kept my son in Virtual Academy last year, to limit our exposure as a family. And it wasn't the most ideal circumstance, but we made it work, and we made it through that year. Not having that option this year, frankly, worries me. I will be sending my son to school with a mask regardless of the decision that you all make tonight. And I will be as safe as we can. But there is sort of growing stories and evidence in the communities around chronic illnesses that many of the sort of COVID long haulers, as they're calling, sort of folks who have seen these longer term symptoms go on even after they've mostly recovered, are similar to chronic illnesses like chronic fatigue syndrome or other illnesses like that. And I would not wish on my own son or any of our children in Woburn or anyone's children in the country effects like that they will live with for potentially the rest of their lives. And the CDC guidance, as several have said, recommends masks for those who are unvaccinated. Our young kids cannot be vaccinated. I really hope that we can follow the recommendations in science and mandate masks. And just to close out my statements, I do want to thank the school committee and the school administration and all the parents here. Everyone did an amazing job in the previous school year, and I have the utmost respect for the teachers and education professionals in the school committee in this city. I'm proud to live here and have a group that will listen to its residents like this, so thank you.
Thank you, Mr. Lane. We have a great team, right? Superintendent Crowley?
That's it.
Right. Okay. Moving on to Nancy Whipple.
I just want to get myself unmuted. Hi, my name's Nancy Whipple. I have two students who attend the Reeves Elementary School. One child will be going into the 4th grade, and one child is in the, she's going to be in 2nd grade, which is in the PALS program. She has Down syndrome. She was born with a hole in her heart, which has been thankfully fixed and hasn't had any medical issues, thankfully, but she certainly is more at risk. So I did write a letter, and I'm just going to read my letter so everyone else can hear it. I'm writing asking to please ask masks for all students and staff, regardless of their vaccination status. The data is clear. Masks have been working to help mitigate the spread of COVID. If you look at the data from schools around the country, you can see that those school districts who have not had mask mandates have seen an increase in cases. The schools in Georgia have already had to go back to virtual learning, some of the schools. Both my children struggled with virtual learning last year, and while I applaud the teachers for the work that they put into teaching in that new way, it was not a good substitute for in-person learning. The shortened day took away from so much from the children. My younger daughter, who was in the PALS program, got very little education on the days that she was virtual. In the spring, she literally just cried and ran away from the iPad. Because of her special needs, she couldn't focus for more than 10 minutes at a time. It's just not acceptable for her to learn that way. I was grateful she was able to be in person 4 days a week. But again, the shortened school day took away so much for her. She was also supposed to have inclusion time with her neurotypical peers. However, because of the setup and the cohort, she was not able to do it. That had an effect on both her educational advancement as well as her social advancement. I am a nurse in a nursing home. Nursing homes across the state are starting to see an uptick of cases in both staff and residents again. So I know, medically speaking, COVID might not be so bad for most people. One of our staff got it. She's never been able to return to work. She won't be able to work again. But what about those people, the staff, the kids, who it is bad for it? What about all those lives that have been lost? I personally do not want to take the chance with my children's lives or the lives of their classmates or their teachers that they might not get it so badly. I know masks are uncomfortable. I wear one all day long, 8 hours a day. But I also know that being sick and being in the hospital is very uncomfortable. They have not been approved a vaccine for children under the ages of 12 yet. Because of that, our children are even at a greater risk from getting sick from COVID. I'm asking you to do the right thing and to require masks for students and staff for the fall. After a vaccine has been approved for the young children, I will reconsider my stand. But for now, I truly believe that is what is best for everyone to continue to wearing their masks. And to make a point to some people, the vaccine has been approved by the FDA. It has been approved for emergency use. Many businesses, including nursing homes now, they are all required to have the vaccine as staff. Whether they work with the patients or not, we have to have the vaccine.
Ms. Whipple, 10 seconds.
Thank you. That's all I'll say. Thank you for your time.
Okay. Thank you.
Do we have an idea how many more people?
Good question, Dr. Wells. One, maybe two?
Okay.
Thank you. Allison Van Deventer, is that right?
Van Deventer.
Van Deventer. You actually gave me the pronunciation. I still got it wrong. I'm sorry.
Don't blame anyone for getting it wrong. Thank you very much for giving me the chance to speak. So my name is Allison Van Deventer, and I'm the parent of an incoming first grader at the Malcolm White. And I'm asking you to vote to require masks. So none of us wants to be in a pandemic or to be sending our kids to school in the middle of a pandemic, but here we are, right? This is reality. And we can all agree, I think, that our kids need to be in school, and specifically that we need to do everything that we possibly can to make it possible for them to learn in person in school. I think we can all agree on the importance of this after the past year and a half. We also know that the Delta variant is more than twice as contagious as the original virus, so we have to be very careful about generalizing to this year from studies that were conducted last year. So we're seeing in southern states in the U.S. what is happening when Delta spreads through children. We're beginning to see what happens when schools open without mask mandates and other precautions. And it doesn't look good. It results in infections and outbreaks and quarantines and kids missing school, and sometimes all schools having to go remote. We can all agree that that's not what we want. It can really be thought of in some ways as a numbers game. So yes, less than 2% of kids who get it, we think, will have to be hospitalized, and that's great. We can feel some personal hope when looking at those numbers. But if COVID and particularly the Delta variant, runs through all of our kids, then there will not be enough pediatric hospital beds for them. And if other states near us are experiencing the same problem, we won't be able to send them out of state and kids will die. So masks, as other people have pointed out, are not going to be forever. No one is talking about making this what the normal for years and years to come. There are some endpoints to masking that we can talk about, like
when everyone who wants to has had a chance to be vaccinated, or community spread thresholds. What I'm saying right now is that our kids need school and they need to be kept safe in school. So I'm asking you to join the 54 other districts in Massachusetts who've already implemented mask mandates. Let's keep our kids learning safely and in school. Thank you very much.
Thank you, Ms. Van Deventer. Emery Popolowski.
Hi, Ellen. Thank you. I just wanted to, I'll keep my comments brief. I know we've had a lot of great...
You have 3 minutes.
Already stating a lot of the facts, everything that's been provided to us by the CDC, which is a very great group of well-educated, well-renowned scientists with factual, empirical data that should be followed. My comment is relating to also the letter that I sent to you all earlier today. When I think about whether or not we're going to send our children in requesting mask wearing, I think about how that this is a prevention that we can do to help save children. For my family and myself, back in 2014, my nephew, who is 8 years old and he was in the 3rd grade out in Gardner, Mass, was killed at his school. He died because the school did not follow guidance that had been given about getting rid of older television sets and the carts that they were on. Now, guidance had been provided that these sets were not reliable, that data showed they tipped over and caused severe injuries to children. Because that data was ignored, my nephew, in front of other children, had this entire cart fall over on top of his head one day at school on February 6th. And to say that was traumatizing is an understatement. And when I think about here that we are being provided guidance by the CDC to help save children, whether it's from death or from long-term COVID issues or people that the children come in contact with, that's what I think about. I think about that I've had to go through that. I've had to sit in the hospital room. We were the emergency contacts for him and hold his hand as he passed away within the hour of the accident. And that's what I'm thinking about here. I'm not thinking about the political side of it, of freedom of speech or any of that stuff. I'm not thinking about, kind of made up data everywhere. It's that this is legitimate need coming through. These are legitimate, it's data showing to help save our kids and to help make sure that our kids and our community members that we are all rely on, that we are all here together, are okay. And until everyone who is able to can get vaccinated and that we can have better control of COVID, because it may not go away. I really think that, mask wearing and showing a kind of positive and healthy example for our children will help our children. And I want to, thank everyone for speaking tonight, and thank you guys for the option to speak, and I am done.
Heather Grossclass.
Hello, thank you for allowing me to speak tonight. I'm a parent of a rising 2nd grader, Malcolm White, and we unfortunately had a personal experience recently. Our 4-year-old daughter had contracted COVID at our daycare center, and it went to the daycare center, caused 20 cases. They had to close down. We as a family had worn masks in our house for the entire 2.5 weeks that we had to be quarantined, including our son. And because of the mask wearing, our son never contracted COVID. So we felt very blessed, that our daughter had a mild case, but it was very upsetting to our lifestyle as a parent. We had to miss work. We had all these concerns about our 2 children with asthma and if they could potentially have post complications. And like other people had said, we don't know the long-term effects in children, and it's very concerning. So I really hope as a parent and as a pediatric nurse practitioner at Boston Children's Hospital who sees these cases and is continually seeing patients that are coming down with COVID, that we are requiring masking during the school year. It is important for safety of our children, the teachers, the parents, everybody involved. Thank you.
Thank you, Heather.
Madam Chairman?
Craig Moskowitz, please.
May I make a suggestion? If people have sent us...
Craig Moskowitz, the parent of 2 incoming 1st graders at the Linscott. So thank you for your time today. Thanks for the opportunity to speak.
Of course, sir.
And thanks to everybody, too. Everybody came very prepared. There was a lot of good data that was shared. I think people spent a lot of time. And if I know one thing about everybody that spoke and everyone that's listening on the call is I think we all want what's best for ourselves and each other. And there's so many things that are changing right now. There's so much data, again, that's out there. It's tough to pinpoint one thing and look at that and say that this is the way that we're going to go with it because this is what's best and I know that. And I think it's really tough for the committee to make a decision, a mandate, because they know something. If you look at the United States government, they must have a reason why they haven't mandated masks outdoors, indoors, wherever. If you look at the state of Mass, there must be a reason. If you look at the city of Woburn, there must be a reason why they haven't mandated masks either. I wish I knew why they made that decision to not do that. I hope it's because they are putting that decision in the people's hands. It's probably because they don't know what's best either. So what I ask the committee tonight is to leave the decision up to the individuals on whether to mask. Thank you.
Thank you, Mr. Markowitz. Okay, there are two more speakers, and then I think that the committee might decide to close public comment. So we'll go Valerie O'Brien. I know you're there.
Yep. Can you hear me?
Yes, I can.
Hi, Ellen. How are you?
I'm well, thank you. Just hanging out. Go ahead, I'm sorry. Go ahead.
That's okay. So I'm just going to read my letter that I submitted to you guys today. I'm a mom of 5 kids. I have a college student. I have 2 seniors entering the high school senior year. And I have a Kennedy 8th grader and a 3rd grader, incoming 3rd grader at the Goodyear. So members of the school committee and Dr. Crowley, as a pediatric nurse and mother of 4 current Woburn students, I am writing to urge you to make mask wearing mandatory for all students and staff this coming school year, regardless of vaccination. I think we can all agree that we are not where we had hoped we would be entering into the 2021-2022 school year, due in part to the more contagious Delta variant. We are, though, in a better position than we were last year to keep our children healthy mentally and physically while keeping them in the classroom. We all have the same goal. We want our children in school with as few disruptions as possible. Universal mask wearing coupled with physical distancing, safe lunches outside or distanced at least 6 feet, hand washing and proper ventilation are our best tools to accomplish this. We learned this from last year. Ask any pediatrician and they will tell you the cases of flu, cold, strep, and stomach viruses were decreased significantly due to the effects of layered mitigation, including mask wearing in schools. I have twin daughters entering their senior year. My oldest daughter was part of the 2020 class of Woburn High School that was not able to celebrate their graduation, prom, etc., and attended her first year of college from our basement. As you can imagine, this has caused a huge disruption to her and her peers' lives, the effects of which we are still seeing and will for some time. I do not want this for my other children. I want their senior year to be as normal as possible with as little disruptions as possible. Schools without masks will be subject to closures and quarantines more than those with universal masking. We know this from DESE's latest regulations that just came out. This has already been seen in states that have gone back to school without universal mask mandates. You have been charged with making a decision that no one wants to make. Leadership demands difficult decisions in difficult times. In preparation for this letter, I reviewed as much information as I could get my hands on. Numerous peer-reviewed studies, articles posted by respected infectious disease doctors, and DESE's latest information for schools, as well as many other scientific-based articles. I sincerely hope you have spent the last few weeks doing the same. As I'm sure you are aware, this decision before you will directly impact the health and safety of the entire Woburn school system, their families, and essentially the entire Woburn community. Some key takeaways are the CDC and American Academy of Pediatrics guidelines for schools, both which recommend universal masking for all students and staff over 2 years of age, regardless of vaccination. This cannot and should not be ignored. As a parent of 5 children, I firmly believe that parents should have a choice when something impacts their children, but not when it impacts the health of others. Mask wearing is a public health issue. The choice not to wear a mask could harm someone else. We are not talking about wearing a seatbelt or a helmet. If I chose to send peanut butter to school with my child and she sits near someone with a life-threatening allergy, I am not exercising my choice. I am putting another child at harm.
Ms. O'Brien, 10 seconds.
Okay. The same holds true for mask wearing. Additionally, as a school nurse who was in school all of last year, I can tell you that students do not mind wearing masks, and the amount of illness we saw was significantly
Time.
decreased.
Ms. O'Brien, I'm sorry, time.
That's fine.
I just wanted to state for the record that we have a copy of the email, and I have it actually in front of me, so we will enter that as the public record as well.
Okay.
So, thank you very much.
Thank you.
Okay. Last person, Corinne Genova. Last person.
Hi, Ellen. How are you?
I'm well, thanks.
My name is Corinne Chinova. I have 2 children at the Malcolm White. One's 1st grade soon, and one will be 3rd grade. So I'm also a teacher. I'm a physical education and health educator at the high school level, and last few years I've been at the elementary level. And I will also say, as my husband had spoken as a teacher, our students were so happy to be back in school. They were thrilled, not just the kids, my own children, but the children that I was teaching. So that is a #1 priority. The CDC, like everyone said, states clearly that everyone ages 2 and up should wear a mask indoors. Our primary responsibility for our students, beyond our education of them, is to provide a safe space for them, a safe space to keep them healthy, to keep the families healthy. That's our job. #1 priority. August 14th, they said just over 1,900 children have been hospitalized by this Delta variant. This variant is different than the COVID-19 we had last year. And 400 children in the United States have died. The United States, as we know, have not handled this very well. We have the highest number of deaths. So if you bring those 400 moms or dads together, parents of those children, and tell them, oh, they're going to die anyway, doesn't matter, that's not going to go over well. Those are 400 lives lost. Again, if you're not worried about yourself or your grandparents or aunts and uncles, think about the children and our responsibility to follow the science, the doctors, and the health guidelines. So, sorry, I wasn't prepared. I just spouted off the things that have been in my head, and thank you for listening.
Thank you, Ms. Genova. Okay, I think that concludes public comment at this juncture. And, I'll just keep moving. So I want to thank everybody for very respectful and intelligent comments. As you know, the Woburn Public Schools values diversity, and that means diversity of opinions and parents being able to speak and express themselves in an entirely manner that's up to them and their families. So we will now move on to reports and presentation of superintendent and staff. And I will leave to Dr. Crowley if he has recommendations from administration with regards to this issue.
Madam Chair.
I'm sorry, Mr. Mulrennan?
If I may, I just want to, I know you mentioned it, and some people have mentioned they received, or they sent letters to us.
Thank you.
The Woburn Public School website also has a link to send letters. So if I received those from the website, I have forwarded those to both Dr. Crowley and our chairperson, Ellen Crowley. So if you've sent one and it wasn't mentioned tonight, we did receive some print copies, and I will see to it that each one of those, through our recording secretary, Ms. McLeod, will be entered into the permanent record for tonight's meeting. So if you weren't mentioned or you didn't get a chance to speak, your minutes and your notes or your emails, correspondence, will have been received, and I'd like to make a motion to make that part of the permanent record, Madam Chair.
Do I have a second?
Second.
Okay, I'm just going to read all the names.
Well, just make it clear that they were all distributed to the entire committee.
The committee has read all of these emails. I provided them with a synthesis of all of the main points. Yes, Ms. Cormier.
I believe we received a letter from Matt Elaine, who spoke tonight, but I didn't see him on the list.
Okay, thank you.
And
all
Emery
right.
as well, that just sent.
Sure. Okay, Mara Costill, Goldstein, Jenna Gray, Carrie Johnson, Maureen Mitchell. Shannon Gibson, Kate Peruzzi, Jasmine
Parasarathi.
Thank you. I'm sorry, Jasmine. I apologize for that. Catherine Clayton, Michelle Dee Vartanian, Bristol Leaper, Christine Coakley, Christine Kitovitz Anderson, Jennifer Jones, Nancy Whipple, James Van Deventer, Dr. Wayne Altman, Heather Carlson, Lisa Murphy, Bridget Myers, Maury Cheharu, Amanda Marshall, Lori McLeod with 37 constituents, Julie Cotton with a petition with 112 constituents, Allison Bennett, Kevin Grosslaus, Laura and Roth Gill, Karen Martell, Elise Meyer, Lindsay Cole, Jeremy Johnson, Betsy Englander, Emery Popolowski, Valerie Palmer O'Brien, Kevin Keeling, Jennifer Barry, Renee Prestia, Rena Mazur, Sarah Bergman McCool, Sharon Crispo, Amy Panicella, Elizabeth McCarthy, Deirdre Doyle, Heather Davis. Before I forget, Allison Bennett wanted me to read the following statements. Masks have been the only tool to diminish the spread of the virus. We need to go with the science, not the passion of parents. Thank God I remembered that. So I have a motion to enter those into the public record. I have a second. Any discussion? All in favor? Aye. The motion passes. All of those emails will be entered into the public record. If by chance I forgot anybody, let me know and we will do that at the next meeting.
Madam Chairman. We
Yes,
also
Dr.
received
Wells.
a communication from the mayor.
Dr. Crowley is going to be reading that as part of his presentation to the school committee. So, moving along, do we need a recess? No, we're good? Okay. Dr. Crowley, do you have a recommendation for the school committee in this regard?
Within 3 minutes. First of all, I do want to thank everybody that spoke tonight, both in person and on Zoom, and for the many, many emails that I've received on the issue of mask wearing as we think about returning to school. There really are no easy answers, and candidly, I'm frustrated that we're in this position again. But I know that Woburn is a community that comes together and cares deeply about each other. I'm also very proud of what the Woburn Public Schools accomplished last year during the pandemic and also this summer. And I'm grateful for the work of everyone in the Woburn Public Schools and the support of our families. We will need to be flexible, patient, and kind, words from last year. And that despite our fatigue, the pandemic has not yet gone away, particularly with the new Delta variant. In the city of Woburn, the number of cases has increased over the last few weeks, with the current 14-day positivity rate near 3%. As a city, 65% are fully vaccinated and 70% have received one shot. Our current vaccination rate in the Woburn Public Schools for students aged 12 to 15 is 66%, and 16 to 19-year-olds is 76%. Along the vaccination lines, in conjunction with the Woburn Board of Health, the Woburn Public Schools are working to put together another vaccination clinic for students 12 and over, hopefully the last week of August, beginning August 30th. It will be held at Woburn Memorial High School with more details to be shared in the very near future. On the issue of being returning to school, I've had multiple conversations with the Woburn Board of Health, Mayor Scott Galvin, nurse leader Mary Heater, Woburn Public Schools nurse leader, Barbara Locke, president of the Woburn Teachers Association, who's here tonight, and members of my leadership team. And at this time, I'd like to read into record a recommendation from the Woburn Board of Health to the school committee. The city of Woburn, along with other Massachusetts communities, has begun to see a rise once again in COVID-19 cases. With the increase in cases and given new evidence on the Delta variant, the Board of Health and Mayor Galvin, in line with CDC guidance, recommend that the Woburn School Committee require universal indoor masking in all pre-K-12 schools to begin the school year, regardless of an individual's vaccination status. The masking requirement should be revisited when the level of vaccination rates among eligible students improves and when the community prevalence of COVID is low, either a test positivity lower than 5% or moderate between 5 and 8%. It has been seen that students benefit from in-person learning and safely returning to full in-time person in the fall of 2021 is a priority. Vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. Promoting vaccination can help schools safely return to full in-person learning, as well as extracurricular activities and sports. In addition to universal indoor masking, CDC recommends schools maintain at least 3 feet of physical distance between students within classrooms to reduce transmission risk. When it is not possible to maintain a physical distance of at least 3 feet, such as when schools cannot fully reopen while maintaining these distances, it is especially important to layer multiple other prevention strategies. Some prevention strategies include promoting vaccination, consistent and correct mask use, physical distancing, screen testing to promptly identify cases, clusters, and outbreaks, ventilation, hand washing, and respiratory etiquette, staying at home when sick and getting tested, contact tracing in combination with isolation and quarantine, cleaning and disinfection. The majority of the City of Woburn schools serve children under the age of 12 who are not yet eligible for vaccination currently. Therefore, this guidance emphasizes implementing layered prevention strategies, e.g., using multiple prevention strategies together consistently to protect students, teachers, staff, visitors, and other members of their household and support full-time in-person learning. Sincerely, the Woburn Board of Health and Mayor Scott Galvin. I would support this recommendation, but I would also suggest that we begin this school year in this way, but we revisit this decision after school has started for a few weeks, as the percent of vaccinated students may increase, and we may be able to consider a bifurcated approach based on additional information. Thank you.
Okay, so that's the superintendent's recommendation. Do I have Ms. Chisholm?
I just have a question. On here, the mayor's talked about releasing masks with a test positivity of less than 5%, and we just said we're at 3. So why are we starting school?
In combination.
I mean, but what? I mean, it says that the vaccination rates among eligible students improved, but we have that at the high school, and we're only at 3%. He's saying under 5, we wouldn't have to have the masks. So that's a contradiction. John, I got the floor for a minute, please. And what if vaccination numbers don't? There's going to be parents that are not going to vaccinate these kids. It has not been FDA approved. We don't know what's going on with this vaccination. So if we don't hit that number, are we going to be masked forever? I mean, we have to have a goal, and when we stop. And if he says under 5 and we're at 3, then why are we going against this recommendation?
Thank you, Mrs. Chisholm.
That's just my first.
Thank you, Ms. Chisholm, for pointing that out, and we can certainly bring that up with the mayor and see if he has any clarification, but thank you for bringing that up. Dr. Wells.
Madam Chairman, I think the mayor's letter speaks to that because he says, and because he talks about the vaccination rate among eligible students and the positivity rate. So I think he's talking about both. The Board of Health is talking about both considerations, not just one.
Okay, so we have 2 separate interpretations of the letter. Okay. So we have a recommendation from the superintendent. I did send around a draft policy, of course, just as a guidepost. I didn't know if the school committee wanted to start there, but I think we need a motion, first of all, to suspend the rules to enact an emergency policy in this regard. We didn't go through policy and we didn't have a first reading, so I'll take that motion just so we can get this on the floor.
Make the motion, Madam Chairman.
All right, so we have a motion. Do we have a second?
Second.
Okay. Any discussion on enacting an emergency policy under these circumstances?
Well, we didn't vote to agree with the recommendation?
No, we did not. No, Mrs. Chisholm. We're just taking the authority out of our normal policy enactment.
Okay.
Okay.
All right.
Okay, all in favor?
Aye.
All right. So what does the committee want to do?
Madam Chairman, I'll make a motion that we institute mandatory mask wearing up until October 31st to be reviewed then.
Okay.
Second.
All right. On the motion, who would like to be heard? Mrs. Chisholm.
This says October 6th. Why are we going to the 31st if we...
Because
It was just a draft guideline, Mrs. Chisholm, but you could certainly do whatever you want to do with that.
I like the end of the month rather than the middle of the month. It gives you a little more time.
Okay. So on the motion, does anyone else want to be heard on it?
If I could, Madam Chairman.
Well, I'll just do seniority, make it easier. Thank you, Ms.
absolutely.
Cormier. Mr. Mulrennan?
Oh.
He usually likes to be last.
I'll be
So-
last, but I'll be first, yeah. So,
Okay.
The recommendation from the superintendent and guidelines with the mayor and the Board of Health, obviously, we really don't have a lot of choices here. We're about ready to start school. Everybody wants to get the kids in school. I don't know how many people came, differing, varying opinions, but I think the goal for all of us is to get the kids in school. Thank you very much. Now, I had some quick notes here from the speakers this evening. We did record your minutes. 18, 20 months ago, this city was so together, so together to get through this. The superintendent, as he started tonight's presentation, I don't want to use the word bewildered, we don't have DESE endorsements here. We don't have a lot of that guidance. There's not a lot. So it's put on us as elected officials to listen to people, which we've done. We're trying to get guidance. We're trying to get the kids in front of their teachers. If that means wearing a mask for a limited time across the board, again, if we have to set a date to revisit the policy, we've had an esteemed doctor offer his services. I'm sure we could probably recruit others that would help us to, enact some sort of a policy. Ms. Crowley gave us a draft to look at what we have in front of us. There's ways to tweak this, maybe phase in different timelines. Again, vaccination rates, COVID rates, test rates, pool testing for our students. We want to get the kids in school, ladies and gentlemen. For the people that are here tonight, I hate to see our city divided like this. It's not what Woburn's about. None of us want this. We don't want to see mask against no mask. I believe we want to get the kids in school. And I would please plead to everyone that allow us to put in this requirement, mandate, whatever you want to call it, short time. When it all began, Dr. Crowley said, we got to shut down for 2 weeks. Chuckle. Anybody else want to laugh and chuckle at shut down for 2 weeks? 3 weeks. How about the rest of the year? How about the whole year? We heard more and more people tell us, my child didn't do this. My child didn't have graduation. My child didn't get to go to a prom. Now, we want these kids back into school. We want these kids to have those activities. If wearing this mask until things change from September to whatever date we can choose, September, October, recommended date and time, we'll revisit a lot of it. But I think the goal here, and I hope the goal here, is to get the kids in the school building. We heard many speakers tonight, both in person and online, say how difficult, challenging, confusing the virtual online stuff was for all. Can't imagine going that, well, I wouldn't want to put that on our administrators tonight to say, oh, by the way, get ready for another shutdown. And we want to know by this date. Good luck with that, people. Let's do what we have to do. Let's get these kids back in front of their teachers. Let's get them back doing their fun activities with their friends. And if it means wearing a mask September, October, I say that would be sufficient for the time being and see where we are come October with the numbers and the testing and whatever else is brought to us. So that's my rant and rave for this evening.
Thank you, Ms. Mulrennan. Mrs. Chisholm?
I just want to reiterate that everybody wants these kids back in school, and we want them back in school, we want them to be safe, and we want everybody to feel comfortable. And I just don't, we talked about going, one side against the other side. That's not what we want to do. These are all our kids. We have to take care of all of our kids. And yes, we have kids suffering, but we heard a mom tonight whose son was affected by this. So we have it on the other side too. It's not just catching COVID that's affecting these kids. So we have to put a deadline to these masks and stick to it, because if you're talking the end of October, guess what happens in November? Everybody gets a cold. And it's going to be COVID related. You're going to have COVID symptoms and everybody's going to be sent home again. So we're going to have this policy. I don't think we can do this tonight because it's going to be strict, as far as I'm concerned, things that need to be in this policy that sets goals. We heard from a student tonight who talks about during mask breaks. These need to be set so parents know that, yes, if we went to school at 8:25, at 10 o'clock the kids can take their masks off and they can breathe and they can make them feel better. And if they get used to it and kids don't mind, that's fine. but we got to make both sides feel that we're caring for them. It's not just the people that want the masks and, oh, we won. It's not about winning against anything. We're in this together. We have 4,000 kids we need to take care of. We have staff that we need to take care of. So we have to be open to like changes and adaptions and stick to it. We can't be saying to people, okay, under 5, we take the masks off. Oh, no, it's 3, we're going to stay on the masks. We need to be able, because kids are not going to get vaccinated. There's parents that feel very, very strongly that vaccinations will not take place. We have kids entering our schools that vaccinations are not in place that we mandate. So we cannot hold that against these parents. So I think that we need to have a little bit more work than just at 9 o'clock tonight going over this policy. So I think we need to have another meeting to do this, but we have to make sure that parents realize that they have been hurt. Both sides have been hurt. And we will pay attention to these numbers, and we'll watch these numbers. We're here for you, for all of you, for all of our kids. I mean, there's sick kids in the schools that we have to worry about. There's compromised kids that go to school every day that we have to worry about. So we will take care of those, but I do think that we need to go through this more and fine-tune this because there's not set marks that we need to have in here. That's my rant.
Thank you, Ms. Chisholm. I have to ask the audience to not applaud. I understand. I always applaud to Ms. Chisholm too when she speaks because, you know, but we're in the middle of deliberation, so please, thank you so much. So, Mrs. Chisholm, I'm hearing that you are, I'm just trying to build a consensus here. You would be okay with a sort of temporary mandate, but your position is that it should have an end date.
Yes.
Okay, got it. Thank you.
We could schedule a meeting for the end of August or whatever, as long as we have time for maybe administration to tweak what they think or go through it and get back and we can meet and vote.
Yeah, I think what we're doing here, I'm sorry to interrupt the deliberation, but I think what we're doing is we're just getting over the hump of a mask mandate, and then we can decide what the committee wants to do in order to get. Right. Okay, thank you. All right, Dr. Wells.
Yeah, so I support the mask mandate going till October 31st. I think we want to be careful when we're writing a policy. A policy is supposed to be guidance for the administration to write the protocols for what happens. I want to make sure that we don't overstep and blur our policy with protocol so that, you know, specifying certain things I think is not an appropriate place for the policy. So if we're going to work on it, I think we want to be careful about that. I think we also want to make sure, you know, in looking over your potential policy, there were exceptions for staff. I don't think that's appropriate because it just leads to judgment calls. It was about allowing people to take off masks at certain times during the building. So I think we want to look at that because I think it makes it harder to administer if we're making it too flexible. I think basically what it comes down to is we're here to get the schools open, to have education. And the way we're going to do that is to protect the students and staff and keep the schools open. And the way we're going to do that is following the lead of the medical experts. These are the people that are paid to review all the information. People gave lots of information out here. You know, we can all evaluate ourselves, but these are the people that are trained to evaluate that information and provide guidance for us. And so I think we have to follow them. Currently, the CDC guidance is for mask wearing in the schools. So I think we have to follow that. You know, this is an inconvenience, but it's for the common good. This is, I think, one of the things that has to be learned from this experience, because sometimes I think it skips people's mind that lots of times people have to do things for the betterment of the common good. We celebrate the veterans that go out and serve. They do that, they inconvenience their lives. Some of them give their lives for the common good. So I think we as a public can sit here and say, we're going to wear a mask. It's inconvenient for everybody. Everybody knows that, but it's for the common good, to get the schools open, to get the students educated so they don't lose any more education time.
Okay. Thank you, Dr. Wells. So, two, you think that this policy needs work as well. So you would also be in favor of a vote tonight for some sort of mandate, but then do some more policy work and bring it back?
Or we can do it tonight.
Thank you, Dr. Wells. Mr. Kissel, did you want to speak on the motion?
Yes, I'm echoing pretty much everyone else's comments, which is that we want to get the kids back in school. That's our goal. Talking to a lot of parents that had kids doing virtual academy, the split days and so on. It worked the best it could, but it's definitely not ideal. Dr. Altman mentioned, and I think actually the superintendent as well, the high school, if I've got the numbers right, was 67% vaccinated, but 76 have their 16-year-old. 16, yeah. So I guess my question is there any thought on, we have different levels of school, obviously. We have the elementary, and that seems to be the majority of what I'm hearing with the emails and so on. It's all, my child's 12 or under and can't get vaccinated. So the ones that can, and when we hit that threshold, that number that we kind of think would work, would that make more sense at the high school that maybe we talk about a different policy or a different level of policies at the high school? And if that's the case, I think starting off the school year with masks, I voted on the summer school to release them because the numbers were different then. Things have changed, and I think we all understood that as they change, we'll make different decisions, and I think we've said that over and over tonight. So having said that, it kind of makes sense to start with the policy, to Dr. Wells's point of October 31st. I think Mrs. Chisholm mentioned there has to be a deadline, and I'm not sure if we want to say a deadline or just review it again by the certain date, as opposed to the deadline is masks come off, because obviously we want to have those off as quickly as we can. But I think we have to review it on that and not so much say the deadline is this date, and I think people might be confused and think masks are off. Obviously, if the numbers are worse and the world isn't doing well, and Woburn has the numbers up, we have to review that. And so that's just my little bit. So I got just a question about the starting off masks, then we'll see where we go.
Okay, thank you, Mr. Kissel.
All
All right, Ms. Cormier, sorry for the delay.
Not a problem, thank you. The comfort of the few do not outweigh the public health needs of the many. We have a responsibility for the health and safety of all Woburn students, and as such, should use all mitigation strategies available to us at this time to ensure schools can stay open in full in-person learning. DESE and all the other groups have stated that this is the best way to learn, and the best way to keep students in schools and schools open is to require masks for everyone, regardless of vaccination status. This is not about vaccinated versus non-vaccinated. This is about a disease variant that can still transmit despite vaccination status. Though those vaccinated are more protected, they may be less symptomatic and are unlikely to be hospitalized, they nonetheless can transmit the virus to the vulnerable. Vaccinated high school students can still be infected and transmit to unvaccinated siblings, other vulnerable family members, teachers, and staff. I'm also curious how we will differentiate between the vaccinated and unvaccinated. Do we provide a lanyard or other physical identifier singling out those who are or are not vaccinated? Vaccinated teachers wearing masks model the behavior for younger students, which creates a culture of masking that does not single out certain students or staff. Despite my own full vaccination status, I continue to mask when around groups as I am tonight, as I would not want to risk transmitting the virus to others if I were infected. With over 620,000 people dead in this country due to COVID, I find that the percentage of children may be lower, but I don't think any deaths should be considered acceptable. And while some will argue the virus has a high survival rate, there can be a stark difference between survival and return to full function, as those with lasting damage from the virus can attest. Even if the children are not at serious risk, the more we do as a community to minimize the infection rates benefits all of the community. We have made sacrifices to keep ourselves, our families, and our community safe. Many may have agreed to vaccinate due to the promise of removal of masking. Unfortunately, this novel virus continues to evolve, and with current information available, masking is worth the effort. And this is why masks are still imperative in our schools. I've spent the last 10 years as a pediatric nurse practitioner, 3 years as a student of public health, and I've spent the last 18 months doing everything I can to keep my patients and staff safe from COVID-19. It's not always perfect, but every earnest effort we can make to combat this virus is a step in the right direction. I'd rather look back and know that we did everything we could instead of wondering if we could have done more. Thank you.
Thank you, Ms. Cormier. And Mr. Lipset.
There are levels on which I find it hard to add much to what my colleagues have already said. I will say this, that over the past 18 months, as a school committee member, as a high school history teacher, as a parent of an unvaccinated 8-year-old, I've seen education during a pandemic from far more angles than I would have cared to. I remember at the end of last year, when the state of emergency came to an end, and when we had sort of that light at the end of the tunnel. I also remember when we went, when students at my high school went back to school full in person, and we were all wearing masks. But I bonded more with my students in those few weeks of school than I had all year under a hybrid system. Masks or no, we got to be human beings together in ways that hadn't been the case to that point. And that it was a powerful thing. It was almost like a new school year. And I think looking back at that, none of us wanted to be wearing masks. I don't like teaching in a mask. I have to repeat myself more than I care to. I have to lean in and listen to students as opposed to being able to hear them across the room. I can't necessarily gather their facial expressions as well as I could, but we muddle through. It was better than the alternative. I think a lot about those students in our, and we heard reference to a few children today, students who are unvaccinated and who are medically fragile, who are at risk every day that they come into contact with other people. I think about the responsibility that we have when talking about children who we are not, I haven't done my customary in a COVID meeting, Dr. Crowley, bludgeoning of Desi. Now seems like a good time. The governor of Massachusetts, the Department of Elementary and Secondary Education, to a lesser degree the Department of Public Health in Massachusetts, have abdicated their responsibility to the children of this state. And they've placed that responsibility on your shoulders, on your team's shoulders, on our shoulders. And now that we have that responsibility, we have to think about the most vulnerable students in our care. And we have a lot of them. And to me, the idea of sending my child into a school without a mask, or into a school where, my child would go to school with a mask regardless, but into a school where people may be unmasked at the risk of students in our building is not acceptable to me. And I hope that even those, many of you in the audience today who don't support a mask mandate can understand that particular viewpoint. So I absolutely support the idea of starting the year at a mask mandate. I like the idea of a hard date to revisit. I'll agree with Mr. Kissel. I don't think we should say that this is a hard date to end masking. We need to be able to be flexible. We've seen how often this pandemic can change, how often this pandemic can move around. This is not a new thing. This is what viruses do. Right? This is what happened with the 1918 flu pandemic. It went through many different variations before it arrived at the variation that we now know of. And so I think that's the right way forward. We start with a mandate. We revisit it. We see where the numbers go. We see where vaccinations go, and we hold to that responsibility to our students. Thank you.
All right. So I'm hearing a consensus. So the joy of a chair is actually maybe having some agreement. So,
Madam Chairman, so just to clarify, the policy expiration date would be October 31st, which gives the committee the opportunity to review it before then, to extend it or whatever. That's what I meant.
So let's vote on a mask mandate until October 31st, and then we can maybe talk about what the next steps are in order to get something written in front of the school committee. How does that sound?
Starting on what date, Madam Chairman? Today?
Today.
Okay.
Yeah. Okay. So I have a motion and a second to institute a mask mandate starting at 9:08 p.m. No, 9:20 p.m. Until October 31st. All in favor?
Aye.
Aye. That motion passes 7-0. The Woburn School Committee has instituted a mask mandate on everybody, correct? Starting now until October 31st. We do not have a written policy. What would the school committee like to do with regards to the process to institute a written policy? I have options. We can meet on September right before school and finalize a policy. Ms. Chisholm expressed a disagreement with she may want to advocate for a deadline versus a review. So let's give her an opportunity to do that. So is everyone okay with meeting before the start of school?
Absolutely.
Yes, Mrs. Chisholm.
Do you think it should go to policy? That way the superintendent and his team could get back to the smaller group. We can send it around to everybody to
Yeah.
review so that we scuttle out some of the comments that we're not going to
Scuttle. Okay, yeah, of course.
that way we-
I can send it to policy.
I'm
ready.
Yes?
So how's it going to, should we send our comments to policy? So that, otherwise we're just going to be back at the same spot?
Yeah.
Okay.
Yes. You can go to policy, of course, or you can send your not your
opinion.
Not your opinions.
Comments.
My recommendations, they're just like any other policy.
Any other
Yeah.
subcommittee meeting we have, we can take and include anybody that sends in.
Yep.
Because we could even start with this basic one if we would like
Right,
to do
that's
that.
that's what I think that's probably the best idea.
Okay.
To start with,
I always have the best ideas.
yeah, I know.
And who's on policy is Mrs. Chisholm, Mr. Kissel, and Mr. Mayor? Okay. All right. So we'll send it to policy, see what you guys can recommend to the full committee. And then, of course, we'll all have a chance to deliberate it, the full committee. And I'm sorry, Mr. Kissel.
Real quick, so you have this face covering file number EBCFA. My glasses are fogging up, sorry.
Yeah.
EBCFA.
I'm sorry, Mr. Kissel.
Where did you, this is from?
This is MASC.
MASC, which they sent to us.
Yes.
With comments.
Yes.
With comments, yes. So my suggestion as policy chairperson, I'll be working with Dr. Baldessari. Had to look at your name, it's been a little while.
Sorry.
Is to make comments based on this and any additionals, and then try to keep it as, obviously, as neat as possible, because then we'll work from that and come up with something, and then we'll pass it around as a draft, publicly.
We have the pre-existing policy in this, and if the committee has any other comments just to send forward that we can consider in the subcommittee, and then we'll try to bring everybody's language into that.
And what we'll do is, the existing policy as well as the draft from MASC is get all of that to you, so you have everything to work with.
Yes, and make sure all of your comments, recommendations be sent to Dr. Baldessari, maybe not to other school committee members.
Right, just one person.
Yeah.
Yeah.
Thank you, Mrs. Chisholm, yes. Okay.
Madam Chairman.
Yes, of course, Dr.
So
Wells.
we had Dr. Altman give a potential proposal.
Yes.
And so I think maybe it might be appropriate that a working group be formed to examine that proposal. I heard some of the pieces, I read the email that we got from the superintendent relaying that. I think there's a lot of questions and so forth. So I would recommend that a working group be formed consisting of the superintendent and representatives of the school committee to further review that and make a recommendation to the school committee at some point.
I think that's a great idea. Thank you, Dr. Wells. Are you making a motion to that?
Yes.
Or okay.
Second.
So, okay. Ms. Cormier, just
I'm on it.
all right. So there's a motion to form a working group, and I'm looking at President Locke, and I think that she would love to join that group. So, all in favor?
Aye.
Okay, that motion passes. So, yes, Mrs.
I'd like to volunteer for that
Oh,
working
great.
group if necessary.
All right, I'll appoint Ms. Cormier to that discussion group.
I'll add my name to the list as well.
Okay, Mr. Lipset. You guys can fight in the parking lot as to who is.
He's going down.
If it's only one.
We can
Yeah.
send our comments to
Appreciate
That group as well.
Yeah, we'll see what comes out of that. I know Ms. Callanan had represented before that she would be willing to do whatever the school committee wanted in terms of figuring out who was vaccinated and all that, so I don't know if she can join that group too. Okay, any more business?
We
No.
need to set a date for our meeting.
Yeah, let's do that. So this is a meeting to look at the language specific to face coverings and other things. And so school starts on the 9th.
We want to do the 31st of August?
I can't.
Okay, how about
I can't.
September 1st?
Yeah, so we have
Yes.
to call the meeting first.
Yeah,
Is September 1st okay for everybody?
No.
September 2nd?
Yes.
September 2nd good for everybody?
Yes.
Okay. September 2nd. All right.
6:30? What do you want to do?
We have to do 7:30, is that right, Ms.
7:30 would be lovely.
On a Thursday?
Okay, let's do 7:30, September 2nd, special meeting,
So just
To-
specific to the policy.
specific to the language
Language,
of
that's
the face covering. All right. On the agenda, I see that we have subcommittee meetings. Do I have a motion to table?
Yep.
Okay.
We'll delay the subcommittee reports.
Do we have updates from the superintendent?
People, I need a
We'll do that.
second and a vote. Second, all right.
In favor?
Ready to do that?
All in favor?
Aye.
A motion passes?
Updates from the superintendent, he already gave that.
Okay,
That
yeah.
Okay.
Dr. Crowley, yeah, did you have any other further updates for the school committee?
Did we want to update, Madam Chairman, about our meeting with the mayor regarding the buildings, or do you want to wait for another meeting?
I would appreciate it if we could wait unless there's something pressing.
No.
Okay. All right, is there anything else?
Motion to adjourn.
Do we have executive session?
No.
Okay, motion to adjourn?
Second.
All in favor?
Aye.
School committee is adjourned.